Hello everyone, how are you? My name is Lynette Onyango. I'm a clinician. Last week we discussed about urinary tract infection, and today I've come up with another nice topic known as the lower backache, a condition that affects many people worldwide and across. This condition affects the young and the elderly, both males and females, but more common in females than in males. If 10 people are chosen randomly, and then out of these 10 people, you'll find out that at least one of them is experiencing this kind of condition. It's a condition that peaks at around its prevalence peaks at around 50 to 55 years, but as you continue to age, it becomes more and more common. One day a friend did ask me that, Dr. Are you in pain because you are moving poorly, or you are moving poorly because you are in pain? And that triggered my mind. Um, some of the risk factors to this lower backache. One, we have poor posture and poor ergonomics. When we talk of ergonomics, that's a topic that sometimes I'm so much interested in, because I usually give health talks across on this topic. So when you talk about ergonomics, what do you mean? It means the relationship between you and your work environment, or the relationship between you and those things that you interact with back there in the house. It can be your keyboard, it can be your chair. So that relationship is always very, very important. But it is a whole topic that I will create time and give you a very good discussion on later on, not today. So your posture and your ergonomics is a key here. And then age. As you age, the bone density reduces. And mostly you find out that uh, as you age, we also increase the body weight. So that is a predisposing factor, because at that time, let's say you are at your 60s or you are at your 50s, the bone density has reduced, the bones are now fragile, and if you put any pressure on them, they can even break. So age is a risk factor. And then, of course, being a girl child as well. I've talked about it's more common in females than in males. And then obesity. This is a topic I usually preach to people, that all my patients, when they walk in here, I tell them, my friend, this weight is not good for us. I usually include myself, that this weight is not good for us. We need to work on it, and at least we reduce it. We have what we call the BMI. This is a screening that usually is done freely. So just walk into any health facility and ask them that, I want to know my BMI. Or you just walk in there and then tell them that what I need to know today is my weight and my height. So from there you can do the calculation by yourself in the house. Calculation is simply you take that weight and then you divide by your height squared, and then you get your BMI. So the ranges of BMI, anything that is below 18, that is underweight. You need to work on it. Any weight, any BMI between 18 to 24.9, normal. That is what we require across. Any BMI between 25 to 29.9, you are overweight. You need to work hard and come back to normal weight. Any BMI above 30, you're obese, my friend. Obese. So in obese, here we have obese type 1, type 2, type 3. So you need to work hard so that you can come back to overweight, and then work hard from overweight, you get to the normal weight. So weight is as well a risk factor, and people ask, how does weight relate to lower backache? Now, that is very simple. I'll ask you to take a jerry can of 20 liters and then have your hand there and place it on it. You will feel a lot of pain. It can even fracture some of the bones in that hand. So that is a risk factor that we have. Physical inactivity. Usually we wake up in the morning, you wake up, um, you bathe, you go to your work, you get out of work, you're tired, you get to the house, you eat, you sleep. Try as much as possible to create even 1 hour a day just for exercise. Exercise is very healthy for you, and for me as well. So physical inactivity can lead to lower backache, and then we have some conditions of the bone. You can have whatever we call the disc bulge, uh, that is at the back, or I mean on the spine. You can have disc herniation. We can have degenerative conditions like arthritis. We can have lumbar spondylosis, or can have muscle spasms. All these ones can lead to lower backache. And then we also have to taking of alcohol or smoking. And people always ask, now, how is smoking related to a lower backache? In smoking, when you smoke, we develop some conditions of the respiratory, and these conditions can lead you to coughing, and a person can develop chronic cough. When you develop chronic cough, it means that you will be exerting a lot of pressure at the lower back, and maybe you already have a condition like a disc that has started to bulge. So as you cough, it even bulges more. So that is how we usually associate them. And then depression and anxiety. Depression, they usually say that it causes a lot of tension on the muscles, and this can lead to lower backache. We have several conditions that can lead to what to lower backache, and I've just mentioned a few of them. Now, investigations that are required to be conducted under this. A patient has walked into me here, and then with a concern, Doctor, I've been experiencing lower backache for so long. First of all, lower backache can be classified as acute if it has been in existence for less than 6 weeks. We can have it at subacute if it has been in existence between at least 6 weeks to 12 weeks, or it can be chronic if it has been there for more than 12 weeks. Majorly, we call it long-standing lower backache. So in such cases, you will have to send for investigations. Some of the investigations that we send for in the lower backache are radiological majorly. So radiological, we will have the x-rays here, we can have the CT scans here, we can have the MRI. So for the x-ray, we want to check the curvature of that spine. There's a way that spine has its shape. So we want to check the shape. We want to look at those discs. We want to check are they compressed or they are normal. Sometimes, in most cases, the x-ray will not reveal to us a lot. So in this case, we usually go further and send for more investigations like CT scan or the MRI. So for CT scan and MRI, even if there is a slightest problem, they will always reveal to us. If there is a lumbar spondylosis, it will reveal. If there is a disc bulge, it will reveal. If there is any herniation of the disc, it will reveal. If there is any muscle spasm, it will reveal. If there is any cancer of the bone, it will reveal for us. Any condition that is associated there, it will come out very clearly. Now, you've done these investigations, and you've come up with a diagnosis. Now, from this diagnosis, now you are able to do your management. Now, when it comes to management, we have the pharmacological management and the non-pharmacological management. For the non-pharmacological management, first of all, you'll advise this patient on on lifestyle modification. And what are these lifestyle modifications that this patient might require? One, a kind of foods, especially for these elderly people. You see, as you age, I said the level of calcium in your body is reducing, and this makes you have weak bones. So you will advise this patient on foods that are rich on calcium. You will advise this patient on the diet, the kind of diet that this patient is supposed to take if this patient is obese or overweight. A good diet, that's a topic for another time, but I usually leave my contact behind. You can always just give me a call and then we talk, or you can drop a message on WhatsApp. The That table or that plate should have a small carbohydrate, should have a protein, should have a fruit, should have vegetable, and you should have your water there. So drinking a lot of water is also good. You should advise this patient to be conducting exercise each and every time, at least creating 1 hour or even 30 minutes a day to do some exercise. It is very, very important. Bending a lot, you should advise this patient on not to avoid things like bending a lot. Motorbike. You see, let's say you already have a condition like disc bulge, and then you're a frequent user of a motorbike, and you have those bumps. So as you move by, the disc even bulges more and more, and this now you will be experiencing a lot of pain than you had it previously. So these are things that we will advise our patients on. Lifting of heavy materials. We'll advise this patient to avoid lifting of heavy materials. Um, you have done this, the non-pharmacological one. We also have the pharmacological one, where you now come in with the analgesics and the muscle relaxants. You'll advise this patient to take some painkillers. You will give this patient some topical creams, muscle relaxants that he or she can use back at home to relieve him or herself from the pain. But this patient maybe has used to these all these. But again, maybe you've asked this patient to come after 2 weeks, and then the patient comes back and tell you, Doctor, despite the use of painkillers, despite the modification of lifestyle, the pain still persists. What do I do? In that case, listen properly. That is where we now have what we call physiotherapy, which is very, very important. Introduce this patient to physiotherapy. In physiotherapy, you can give this patient 5 sessions, you can give this patient 8 sessions, you can give this patient 10 sessions. And then you alternate these sessions with the painkillers. And you do this very well, and the patient completes the sessions. But again, a patient still come back and tell you, Doctor, despite the painkillers, despite the physiotherapy, despite the lifestyle modification, the pain still persists. It's even now worsening. Now, referral is part and parcel of management. In that case, personally, I know we have our seniors, and those are our seniors are people who include those who have specialized in specific areas. So in this case, we now need to refer to a spine surgeon to go and evaluate this patient to see if there's anything that I have not done in terms of medication that he or she needs to add. Then after that, after the evaluation, maybe the consultant has added 1 or 2 medications and this patient still persists, I still have the pain, then the patient might be exposed to surgery. So surgery is actually the final management here, and the definitive one. So this patient might be done for a surgery. If the nerves were compressed, they will be decompressed. If the discs were bulging, they will be corrected. If there was any herniation, it will be corrected. So after the surgery, the patient will again be put on some medications, and later on will be done for some rehabilitations on things like physiotherapy again. Now, some of the preventions of this, how do we prevent these cases of lower backache? One, we those things that I mentioned up there as the risk factors, those are the things that we need to turn over. So if you are obese or overweight, work on your weight to return it back to the normal weight, the BMI between 18 to 24.9. If you were used to lifting of heavy materials, can we start avoiding that? If you are bending for so long, can we avoid that? If you are taking alcohol, consuming a lot of alcohol and cigarette smoking, these are things that we can avoid. Another thing, age you can't do anything about. So age, we leave it at that point. If you are not doing exercise, you start to do what? To conduct exercise, so that you get relieved. Information is always power, and it's upon you and me to use this information well. If you are not affected, then your neighbor can be affected. You can still share the information. If you're not affected, then your sister, your brother, or any other person, your neighbor, can be affected. So you are able to share the information with them. So my contact I usually leave behind. If there is any question, just drop a WhatsApp message and I will assist you. According to the demand that I received because of the clip that I produced last week, many people requested that I talked about musculoskeletal conditions, and next week I'll be tackling musculoskeletal conditions. These will be including things like arthritis, all those types of arthritis, and how we can manage the joint pains that we usually experience. So thank you so much, my viewers. I'll continue updating. Subscribe to my YouTube so that you can be getting updates each and every time. And I look forward to a very interesting topic discussion that we'll have next week. May you have a good evening.